day, everyone. Dr. James Marcum with another biblical prescription for life. Glad you joined me. It's so nice to be able to share with you. And thank you for your prayers and your comments and for sharing this video as we're trying to make a difference out there in this world. Today, we're going to talk about vitamins, length of life, and mortality. The reason we're doing this is because I recently reviewed a video that was done a few years ago by Dr. Mike. And I looked Dr. Mike up, and he is a young physician who did a video about whether he thought that vitamins were beneficial. And people wanted me to talk about his conclusion and whether it was valid since so many people looked at this. Well, I'm a little bit different than Dr. Mike in many ways, and his conclusion was that vitamins for most people were not beneficial. And I'm going to look at that today after looking at the video and analyzing other data. I'm a little bit different than Dr. Mike for a few reasons. One is I'm quite a bit older than Dr. Mike. I've been practicing for 30 plus years, both in a hospital and a preventive practice. So I get to see sick people. I get to see well people. We have a different continuum. So when physicians see things from a different patient set, sometimes they reach different conclusions about different things. So I add that to the mix. And I'm also different because in my videos, my focus is not so much on the medical. That's important. But I also want to focus on the relationship and truth and the Bible and God and ultimate healing, and look at the problem through that lens as well. So that's how I'm a little bit different. So the question that Dr. Mike dealt with in his video is, does vitamins, should we be taking them every day? That's the basic one. And he basically concluded that for healthy people, probably doesn't help. Before I tackle this subject and look at it in a little bit detail, let's go to a biblical prescription. Let's go to Psalms 146, verse 5. This is very important that we continue to stay in the scripture. This is God talking to us. He is the great physician. He's the one that's going to heal in his time and in his way. It might be through modern medicine. It might be through lifestyle changes. It might be to introducing you videos so you can learn more. But the bottom line, that he is the one that's going to lead us to ultimate healing in his time. Psalms 146:5, it says, "Happy is he who has the God of Jacob for his help, whose hope is in the Lord his God." So vitamins, are they really needed? Well, right now, a lot of people are out there taking vitamins because they hope it's going to do something magically to improve their health. So that they think it's helping. Is it really helping? Well, Dr. Mike did an excellent video. I looked at it and I tend to agree with what he says. And I have a few more things to add to that as there's some extra data that's come to us recently. 1 in 3 take vitamins out there. It's a big industry. Lots of people are making money. If you think about how many people are 1 in 3, I looked at that. That's a lot of people that are taking multivitamins every day. Recently, in an article by the Journal of the American Medical Association, the Network Open, and it just came out recently. And this is one of the best studies I've ever seen on looking at this. And they looked at 3 different prospective cohorts. This was published just recently in 2024. And they looked at 390,000 plus healthy adults. They followed them for up to 20 years. And in this study, they also found that there were 164,000 deaths. So they looked at those and they tried to eliminate from the study analysis the ones with healthy lifestyles, those sick. They try to mitigate those effects. And the bottom line in this study, it goes right along with what Dr. Mike said. It said this, that the study found that there was no difference in mortality, and they looked at cancer, stroke, all the different mortalities. In this study, in the U.S. adults, multivitamin use was not associated with a mortality benefit. And it says still, many adults are still reporting using multivitamins, and they use them to maintain their health. In fact, a subset of this group found out that some of them, in one of the analysis they had from this study, said taking daily vitamins might actually increase mortality from all causes. So this study agrees with what Dr. Mike's video says, and I agree too. For most healthy adults, and they looked at older adults too, so that's we go for older and younger. Most healthy adults don't need to spend extra money on vitamins. You don't need to do it. You don't need to worry about it. This is something you can throw off the list. Now, with that said, my experiences, that does with healthy adults. Unfortunately, I've worked with many unhealthy adults. And in my opinion, each individual you have to take with their set of circumstances and their health and their belief systems before you make an individual decision. But for people that are pregnant, for older people that sometimes don't eat at all because they're depressed, anxiety, might have dementia, they might benefit. For people with chronic diseases, metabolic diseases, they might benefit. From people with bowel problems, they don't absorb bowels or have had bariatric surgery, they might benefit. From people that are vegan, they don't get everything that everyone else gets, especially some of the B vitamins, they might benefit as well. So those are some subgroups that might benefit. But I agree with Dr. Mike and this last study from the Journal of American Medical Association that came out recently, that people that are healthy really do not benefit from a mortality standpoint from taking a multivitamin every day. In fact, doing this could pose some risk. What are some risks? Well, there's the financial risk that you're taking by taking it. And some people that take multivitamins have a false reassurance that they don't need to eat well. They don't need to eat the fresh vegetables, fruits, nuts, and grains that they need to stay healthy. Also, you can get too many vitamins in you, especially the vitamins like D, A, E, K that tend to build up in fat. So you can get vitamin toxic on a few of these vitamins. So those are some things that I think we should think about, but the bottom line in answering this question is this. Dr. Mike did a video 4 or 5 years ago. Lots of people watched it. He concluded that most healthy people did not need daily multivitamins. Do I agree with Dr. Mike? He's a younger colleague, but I agree with him. I think he looked at it very well. And I think this new study from JAMA that was just put out gives us even more scientific data to show that. Do some subgroups that are sick, that are pregnant, that may be vegans, do they might benefit from taking a multivitamin? The answer is yes, but we have to look at each individual's situation. So that's sort of my opinion, and my approach is a little bit different than most because remember, I believe that there's a place for modern medicine in healing. There's a place for all the things we can do with technology to help symptoms, to improve people's quality of life. There's a place for lifestyle, for eating healthy. There's a place for learning and getting knowledge like we're doing today. But the key to health is pointing people to the power that comes from Christ, the Bible, the source of truth. And let's look at this scripture again from Psalms 146, verse 5. Happy is he who has the God of Jacob for his help. We want God to be our help, to be our ultimate physician, to be our source of truth, to be our permanent healing, to help us look and make decisions on our health care, and to give us the power to make changes and to understanding which modern medical intervention we need, and whose hope is not necessarily in vitamins or in modern medicine or the things we can do, but whose hope is in the Lord, his God. So I hope that clears up a little bit about vitamins and length of life. I agree with Dr. Mike. I agree with the JAMA study that's recently been published. Vitamins, multivitamins daily for healthy people, I don't think increases the mortality. If you're sick, special subgroup as stated, might be a different story. So that's the bottom line from here. If you have a comment, we're more than list. I admit I don't know everything. And if you have something to add to this discussion, please add it below. Share this with your friends and neighbors, especially those that are taking vitamins every day, that eat a balanced diet and they're healthy and have no problems. They might be spending money on things that they don't need to. And also, remember, our world is trying to sell hope. They're trying to create fear, but we want to give you power to make good decisions. That's why we make these videos, to help give you more information, not to tell you what to think, but to sort of give you another option to consider in this well-marketed world where it's hard to know who or even what to believe. I've chosen to look at things through the lens of the Bible, my source of truth, my authority in health. I want to turn to the great physician as my consultant. Even though there's excellent people out there, and Dr. Mike gives us some good advice here on vitamins, I think there are ultimate people out there, but what we want to do differently is focus you on the great physician. So give us a like. Share us with your friends and neighbors. Please leave a comment. Sign up for a newsletter. Help our message to grow throughout the world. I'm Dr. James Marcum. I'm going to be back soon with yet another biblical prescription for life.